Hi, my name is Dr. Taylor Krupp, and I am an associate veterinarian here at Central Providence Veterinary Hospital. My assistant Bailey and I are going to be talking about cat anesthesia today.
Dr. Krupp, what is anesthesia and why can it be necessary for my cat?
Anesthesia is a medically induced state of loss of consciousness and loss of sensation, and we'll utilize it for procedures that we can't do with your pet awake.
What types of procedures typically require anesthesia for my cats?
When your pet is younger, the most common procedure that we'll utilize it for are the spay and neuters. And then as your pet gets older, we may have to use it to help get out like a foreign body if your cat eats something, or for mass removals, stentals, things like that.
Is anesthesia safe for my cats?
For the large majority of our patients, yes, anesthesia is safe. There are risks involved, just like with any procedure, so we just have to make sure that we do some diagnostics prior and monitor closely.
How is the appropriate type and dosage of anesthesia determined for my cat?
Yes, so your pet's drug protocol is made prior to starting that day, and we take into account who your pet is, if they have any underlying conditions such as heart disease or kidney disease, as well as how painful the procedure is going to be. And we take all of that together to help form your cat's plan.
What are the risks and potential long-term side effects of anesthesia in cats?
For the large majority of our kitty cats, anesthesia is a safe and well-tolerated procedure, but there are always risks. So one of those risks are we're using several different drugs to help with this procedure, and your cat can always have an allergic reaction to one of these medications, which can be mild, but it could also be much more serious. We do our best to make sure that we know of any underlying medical concerns, such as heart disease and kidney disease, but we don't always know everything, and we can't always know everything. So there's always a risk of some underlying condition coming to play, leading to things such as like clot formations or even cardiac arrest. Luckily, those complications are very rare, but it's a serious procedure and needs continuous monitoring.
How should I prepare my cat for anesthesia?
Your cat does need to be fasted the night before. That is to make sure that their stomach is empty while they are under anesthesia. And then for us, they come bright and early in the morning so that we can start working on them right away.
What happens to my cat during the anesthesia process?
When your cat comes to us the morning of their procedure, the first thing they're going to get is a new physical exam where we make sure that we're not seeing any new underlying conditions. And then we like to place a IV catheter so that we have direct access to your cat's bloodstream or any other medications they may need that day. There are some kitty cats that may need a little bit of sedation prior to that just to help facilitate the process. And then your cat will be induced when we're ready to move forward with anesthesia, and an endotracheal tube will be placed. That's a tube that's placed into the windpipe or trachea so that we can deliver the gas inhaling to keep them asleep throughout the procedure, but we can also deliver fresh oxygen.
How long does it take for a cat to recover from anesthesia?
Your cat will start that recovery process really as soon as the gas inhalant is turned off, and they should start to wake up within a few minutes. At first, they're often a little disoriented, so we just need to give them time in a quiet, peaceful, warm area to fully recover. And they're usually a little bit off that night and sleepy. The next day, they usually go back to normal.
What should I expect after my cat wakes up from anesthesia?
When your pet comes home that night, they will likely be still pretty groggy. So I usually recommend that you keep them in a nice, warm, quiet area away from a lot of noise, but still close enough that they can be around you while they go through that recovery phase. You can offer water, and we usually say half their normal meal. If they don't want to eat or drink, that's okay. They should go back to normal the next day.
What signs of complications should I watch for after my cat has been under anesthesia?
So, like I said, anything out of their normal besides the fact that they may be a little bit more vocal than normal and they may just be extra sleepy. If you are noticing any vomiting, diarrhea, or changes with their breathing rate or pattern, those are all concerns. And like I said, your cat may be a little bit tired, but if they are so tired that they really just can't stay awake when they normally would, that can be a concern and should be addressed.
How can I help my cat recover quickly and comfortably after anesthesia?
It's really all about giving them time in a safe, warm place, again, away from any chaotic noises or activity, but also close enough that they can be around you for comfort.
What should I do if my cat refuses to eat or drink after anesthesia?
If they refuse food and water the night of anesthesia, I'm okay with that. We will often give anti-nausea medications before any other medications to help prevent nausea, but it can still be at play. We also will give fluids throughout their procedure, so they may just not be thirsty for you at home. They should go back to normal the next day. If they are not, please reach out and let your vet know. It could be a sign that there's something else going on.
Are there specific concerns for senior or high-risk cats regarding anesthesia?
Yeah, so we do our best to make sure we understand the metabolic health of your animal by doing really good physical exams and lab work in advance. The older your pet gets, the more likely there may be a disease process going on that we're going to have to account for and monitor for closely. But no matter how much we look, there's always a chance that there's an underlying disease process that hasn't come to play yet. So that is always the risk of anesthesia. That is all of our questions for today. If you have any questions or concerns, please reach out to your veterinarian.